Everybody ready?
Ready.
Can we turn the radio off over there?
Okay. Good afternoon, ladies and gentlemen. I'd like to welcome you to the FreestoreFoodbank today, and we're delighted to be here today. My name's Todd Portune. I'm the president of the Board of Commissioners for Hamilton County. I'm here with our Director of County Job and Family Services, Moira Weir, with the Director of the FreestoreFoodbank, John Young. And today, during National Cover the Uninsured Week, we are introducing to Hamilton County a program that we're very, very excited about, that we think is going to bring health insurance to over 30,000 uninsured elderly families and children throughout all of Hamilton County, and that is through a partnership between Hamilton County and the FreestoreFoodbank, where we are going to reach out and actively identify and recruit Medicaid-eligible elderly families and children who today don't know if they're eligible, don't know if they can get this coverage, but we're going to find them, we're going to determine their eligibility, we will recruit them, and we will sign them up for Medicaid insurance, because we think that it's very important in Hamilton County that no person go without health insurance who is qualified for health insurance and who can have access to health insurance. We know that there are far too many people who lack access to health care. They don't have a medical home. They're going to the emergency rooms as their physicians of choice. They're not taking care of medical problems until they become huge problems, and little things become crises that make health care far more expensive for the individuals and more expensive for all of us and lead to unhealthy outcomes. That's just not right. It's not right in America, it's not right in Hamilton County, it's not right in a community as rich as ours, and certainly one that is as rich as ours in healthcare resources. So this partnership between Hamilton County, under the auspices of our County Department of Job and Family Services, in partnership with the FreestoreFoodbank, will reach out to identify and recruit and make eligible for Medicaid health insurance. We're going to find over 30,000 people in Hamilton County. That's the goal. Because the goal is, again, that no one who is qualified for this measure of health insurance should go without it. And that's our pledge in Hamilton County. It's a major initiative. We want everyone who doesn't know, who has a question of whether they're eligible, to contact us. John Young's going to go over the details on that. But again, it's critically important for us to do our part to help people who are eligible for this health insurance, for Medicaid coverage. We're going to go out and find people and recruit them, work with them in terms of their eligibility determination. And again, the bottom line is to sign up over 30,000 Medicaid-eligible elderly families and children in Hamilton County. To talk about the specifics of our program, I'm going to hand this over to the Director of the FreestoreFoodbank, our great partner in this effort, Mr. John Young.
Thank you. And I'll just say, on behalf of the FreestoreFoodbank and the community we serve, we're delighted to be in a position to reach out to the community, to provide the kinds of health care benefits that are right now available and going wanted. We think it's very, very important. Studies we've done have indicated that instead of buying food, people are paying physician bills and paying for pharmaceuticals. And that means they're queuing up in our lines in a way that has increased dramatically over the last few years. Right here at the Freestore, for example, we've seen a 50% increase in 2 years in request for service. That 50% increase is from people who have problems like, how do I get my health care covered? That's why we're interested. We think we're going to stabilize the families we work with, and we're very, very appreciative of the opportunity to be a part of this collaboration with Hamilton County and Hamilton County Job and Family Services. I would also say that the increase in pressures on our families. I took a few statistics from a communication we got from the American Sector Partnership today. Dairy prices last year in 2007 rose 13.4%. All our families need dairy products. Poultry prices rose 6.3%. eggs rose 32.6%. I'm not telling you anything you haven't already read, but specifically, these pressures on these families cause great alarm for us in our community. Those families can't work, can't live, can't learn without having access to that kind of food. With more disposable income, we think they'll be able to then purchase the food. That's why we're interested. And again, we thank the county for looking to us to help them with this matter. I want to give you a phone number, and I hope we'll put it on the screen. I'm going to give you the phone number of Lisa Snorton. Just remember Lisa. She's going to be handling calls on this the next couple of days. Her number is 357-4815. 357-4815. So anybody that has an interest can call her. How we will go about doing this is we will, first of all, 40,000 people come right here to the free store for help every year. 40,000 unduplicated individuals. So we think many of the people that we're already serving may be eligible, so we'll do some in-reach investment with those individuals. And then we'll reach out to the community where people show up for church, at churches during the weekend, and at work sites and where they shop. We'll also go to health clinics. We'll go to anywhere where we can find numbers of people who have need for health care coverage that's been currently going on. So we're, again, very pleased, Commissioner Fortune, thank you for your confidence in us. We pledge to work day and night to get this thing on behalf of the citizens. And we know we really care. Thank you.
I'd just like to echo everything that's been said. We're very excited about this partnership. We've had several partnerships with the Freestore that have been very successful. The main message is please, anyone's out there that you think you're eligible to contact us so that we can work with you. We really truly want to reach all the families and children within our community that need help. So at this point, I think we're willing to open up for questions and comments.
Thank you so much. Close.